estimates of the budgetary figures for managing Christmas Island over the next 3 years would suggest that this is costing us close to $500 million per year. With a bipartisan policy on mandatory detention, this picture is inevitable, but it's a deeply disturbing one. And I want to be clear that the disturbing picture for me is not because the numbers have increased and the expenditure has skyrocketed, but because it is unusual in a global context, it's unnecessary, and perhaps more compelling, the UN Human Rights Committee has consistently found that the mandatory detention regime breaches basic human rights and standards. So let's compare those statistics of detention to those asylum seekers living in the community. We estimate there's around 8,000 to 10,000 asylum seekers living in the community who have not yet had their protection application or humanitarian claim determined. A majority live with family, friends or secured work and are living independently. A smaller number have complex vulnerabilities and require more intensive support. Of this vulnerable group, about half receive support from a government-funded program, and about half are left in either destitution or homelessness, or are left for agencies such as ours to care for them without government funding. The estimates from the budget in 2009 to 2010, where the budget set community care pricing, would suggest that this model of community care is costing us $20 million per year. Now, before I again contrast those figures, I want to state that it's in the opinion of the Health Mission Asylum Seeker Project and many other agencies in the sector that the community care budget is not enough. The work that the Asylum Seeker Project undertakes with no federal government funding and a small amount of state government funding is for asylum seekers who may be eligible for the government-funded programs, but they're not large enough for them to be able to access them. I also want to acknowledge, and something I'm going to talk about a bit later, is that housing isn't included in those community care models. So I want to conservatively suggest that if we were to triple the community care budget, and let's take it up to $60,000 per year, $60 million per year, and come back to that comparison. 4,116 people in detention at the cost of $500 million per year, which is effectively $121,500 per person per year. Then we look at the community figures, 8 to 10,000 people living in the community at a cost of $60 million per year. That's $6,000 per person per year. Bearing in mind I've tripled this figure, so it's actually $2,000 that we're paying at the moment. Given this financial contrast, it is almost incomprehensible that both sides of government continue to hold a mandatory detention framework. Financially, mandatory detention is a disaster. We know it's a disaster for the health and welfare of asylum seekers, but from a fiscal responsibility perspective, mandatory detention, which at this stage is looking long-term, despite the detention values that were announced by the Minister for Immigration in 2008. Detention is indefensible when compared to the cost